come in?
James.
Hey.
How is it going?
Pretty good.
Good. It's good to meet you. My name is Dr. Perez.
Okay, nice to meet you.
I believe we spoke on the phone when you made your initial appointment.
Okay, cool.
Okay, perfect. So, if you don't mind, we will go ahead and jump right in.
Okay.
I do have a couple of notes to take as well as a preliminary assessment that we'll go ahead and get started with, okay?
Sure.
So, I have obviously your first name as James. Can you just confirm your last name for me?
Sure. Monroe, Monroe.
Perfect. And what is your date of birth?
2/15/1990.
Okay. Perfect. And would you like to get set up with our patient portal today?
Sure. I don't see why not.
So things like labs, any imaging results and that kind of thing, you can also send direct messages to me on the patient portal.
Okay.
So if you could just give me an updated email, your preferred contact.
Sure. It's jojo.monroe@gmail.com.
Perfect. So you will receive a series of emails and they will all be from Get Well Network. So just look out for that. Definitely check your spam if you don't see anything within a couple hours after you leave today, okay?
Sure.
So we'll go ahead and get started with your preliminary assessment. So I'll just be taking a couple notes on my keyboard here. Are you experiencing any acute symptoms today? Any specific reason for your visit?
No, just a routine checkup.
Okay. And because you are new to the office, can you just tell me when the last time is that you saw your PCP or your primary care provider?
About 7-8 months ago.
Yeah, so pretty up to date with your checkups. Do you usually visit annually?
I do.
Any specific reason you're changing doctor's offices?
No, it's not. Just convenient. My last doctor was closer to my job. Now I work from home, so this is better for me.
This is just closer to your location.
Yep.
Okay. Perfect. And can I just ask you about your pain level today? Are you experiencing any pain on a scale of 1 to 10? 10 being kind of the worst, most acute pain, 1 being no standing pain at this time.
1, no pain.
Perfect. And otherwise no discomfort, numbness, tingling, pins and needles sensation, any discomfort or soreness anywhere in your body?
No, none at all.
Perfect. And no other acute symptoms recently within the last 8 weeks, 2 months, you haven't fallen, no recent surgeries, that kind of thing?
No, nothing.
Perfect. Just making sure we have everything updated in your chart. I don't want to miss anything.
Okay.
It looks like our medical assistant already took your vital signs in the waiting room and they were all within normal limits.
Okay.
Blood pressure is good. I have 124/83.
Okay.
Perfect. Oxygenation levels were about 98%. Looks like your respirations were a little high at 22, but considering you just walked into the office, that probably explains that. So no worries there. And you are not febrile today, so there's no fever, which is good news. You recently come in contact with anybody with any respiratory viruses, flu A or B, rhinovirus, regular common cold, enterovirus, COVID, anything like that?
No one I know is sick currently.
Perfect. And no current respiratory symptoms such as postnasal drip, runny nose, sore throat, swollen tonsils, that kind of thing?
No, none of that.
Okay. Have you had any surgeries?
No, I haven't.
Okay, very lucky. And no broken bones, correct?
Correct.
When is the last time you visited an orthodontist or a dentist?
About 3 months ago.
Perfect. So up to date there.
Yep.
And no acute symptoms with your oral health,
No.
nothing abnormal upon your last visit?
No, nothing at all.
So I'm going to move on to a couple specific questions, kind of moving from head to feet.
Okay.
So any headaches, migraines, pressure buildup behind your eyes, anything like that? Anything to do with your head or your cranial area?
No, nothing.
Okay. You're not prone to migraines?
No, I have some seasonal allergies. I may get an occasional headache, but that's not the case this time of year.
Perfect. And do you take anything for that, like a Claritin or?
Just over the counter.
Okay. So seasonal allergies. Do you have any medical known allergies, such as allergies to medication, topical allergies, anything like that? No,
No.
food allergies?
No, none.
Okay. And you've never had surgery, so we wouldn't know about any possible anesthetic allergies. That's
Right.
okay. Alrighty, moving on to your neck and shoulders. Any issues with mobility, ability to kind of flex and extend your arms? Are you able to bend over okay? No issues with your back?
No.
You've never been told that you have spina bifida, scoliosis, anything like that?
No, no issues with neck or back or shoulders.
Have you ever seen a cardiologist?
No, I never have.
Okay. So no issues with chest pain, heart palpitations, arrhythmia, any abnormal heart rhythms that you may feel, maybe an onset of coughing if you feel like your heart is beating abnormally, nothing like that?
No, nothing like that.
Perfect. Okay, moving on to your upper and lower extremities. Any abnormalities with your arms or legs? Any difficulties moving? Soreness in your joints, elbows, knees, wrists, ankles?
No, nothing extreme. Just the regular, growing with age, aches and pains, but nothing substantial.
Okay. Can you tell me how frequently in a 7-day period you're active for more than 20 minutes at a time? So whether that's standing, walking, any kind of active movement.
Once or twice a week.
Okay. And you do work from home, so.
That's correct.
Okay. Do you sit at a desk?
Yes, I do.
And is that screen, computer use, cell phone?
It's cell phone and laptop use.
Okay. So pretty significant
Yes.
screen use. Okay. I will get back to that. Any issues with your feet, toes, arch support, anything like that?
No, none at all.
Perfect. And can you just tell me what size shoe you wear?
Size 17.
17, and you feel like that fits you adequately?
It does. I'm a 16 triple E, but
Okay, so
I normally have
wider.
to go to 17.
Okay. Perfect. And you don't wear any custom orthotics, correct?
No, I don't.
Alright, so going back to that screen use, can you tell me if you have any symptoms with your eyes, any eye pain, symptoms of dryness or over tearing, anything that would lead to like an eye strain from excessive screen use?
Yes, I do have dry eyes if I do use the screen, full day and I'm on my phone and the computer. By the end of the day, my eyes will be pretty dry.
Okay. Can you tell me how many hours a day you typically use a screen, mainly laptop or cell phone?
At least 8 hours.
Okay, so at least a third of your day.
Yeah.
And is that 5 days a week?
Yes, it is.
Okay. Do you work full time?
Yes, I do.
Okay. So I will take a look inside your eyes just to make sure there's nothing more serious going on.
Okay.
It's likely that it is just an increased screen use, and you've
Okay.
not been working home very long, correct? This is kind of
Right.
a new change for
It
you.
is, yeah.
Okay. So we will go ahead and get started with the physical exam if you don't have any questions for me.
No, I don't.
Okay, perfect. Let me just save this information into your chart.
Okay.
I will have Serena, the medical assistant, go ahead and put all of this information into your Get Well network, and it should all be available for you upon release. Okay, it's pretty
Okay.
immediate. As soon as the medical assistant puts it into the system, it's kind of like a live feed. All of the information and transcripts from your visit will go.
Okay, cool.
Okay. Okay, so let me go ahead and put this away. And I will be donning a pair of gloves. Okay, so I am going to get started with your Penlight. I'm just going to have an overall look kind of at your head and neck area to begin, okay?
Okay.
So you can just look straight ahead for me.
Sure.
Just looking for any kind of visible abnormalities. Typically we see more acute problems happening in the head region, so this is the first area that we like to check. So just having a look at the neck, looking at the thyroid, Looking for any signs of notable edema or abnormal swelling. Anything that could indicate cranial injury. Looking for any abnormalities with the skin, abnormal discoloration, any lumps, bumps, or bruises. Also looking for any lesions or open areas of the skin. Can I just have you turn your head this way for me? Perfect. Not seeing anything acute. Okay. So I'll go ahead and move on to a little bit of a scalp exam if that's okay.
Sure.
So I would like to have a look at your hair and scalp.
Okay.
Just kind of having a look at the overall texture of your hair, looking for any more obvious differences here that might be noticeable, but so far not seeing anything. Hair texture itself appears to be very thick and healthy. Doesn't feel overly dry to the touch. It's also not overly greasy. Let me know if any of this is uncomfortable for you, James.
Okay.
Do you feel any pain or discomfort here? I'm going to do a little bit of deeper palpation, okay? So just let me know if any of this hurts. Just feeling around for any bumps. You've not fallen recently, so I don't suspect you'll have any kind of lesions or head injuries, but it's always good to double check. Can you tell me how frequently you wash your hair?
At least twice a week.
Okay. And then you wash with shampoo and conditioner?
Yes, shampoo and conditioner.
Do you ever have any issues with dandruff or any signs of seborrheic dermatitis, flaking, itching,
Not majorly.
scalp burning?
I do have dry skin, so
Okay.
just a little bit here and there, but nothing excessive.
Okay. So just using a little metal comb here to kind of separate some sections of your hair. Let me know if I pull your hair too much. I just want to have a little bit of a deeper look at your scalp. So do you use any specific shampoo to kind of alleviate some of that scalp dryness?
Yes, I do have a regular shampoo and also have a medicated Head and Shoulders, I believe.
Okay. And that's not something that was prescribed to you, correct? It's just an over-the-counter shampoo.
It's extra strong.
So it's not like a ketoconazole shampoo, but it does have some medicated properties, and it does appear to be working fairly well. I'm not noticing any excess flaking. There's no signs of dryness at this time. When is the last time you washed your hair prior to today?
2 days ago.
Okay. So it still does appear clean and healthy. Just going to do some slight tugging along the hairline here. I'm just looking for any signs of kind of traction alopecia or any abnormal pattern baldness or loosening of the follicle that would lead to excess fallout of your hair.
Okay.
Not noticing any signs of that. No signs or symptoms of folliculitis or any inflammation or bacterial infection of the hair follicle itself, which is good. So you're going to feel me do some slight tugging on your hair. Just performing a little bit of gentle pressure here, looking for, again, any loosening of the hair or the follicle itself. None of this is painful, correct?
No, it's not.
And that pressure feels pretty even throughout.
Yep, correct.
Okay. So I am going to stretch out this portion of your hair to its entirety. I just want to get an idea for the length of your hair. Hair is long. Shaft itself is healthy. There's no signs of weakening of the follicle. Okay. So all of that appears normal. You do have some slight texture variation here at the nape of the neck, which is pretty normal. We tend to have looser pattern hair here, especially for those curly-haired individuals, so you do have a little bit of a looser texture here. That's okay. Just trying to agitate the skin slightly and make sure there's no kind of hidden signs of any dermatitis here along the nape of the neck. all of that appears to be normal. So if it's all right with you, I'll go ahead and have a look inside your beard.
Okay.
Do you wash your beard as frequently as you wash your hair?
I wash it more frequently than my hair.
So always recommend people with facial hair to wash at least 3 times a week, ideally 4, just because obviously this area is more prone to bacteria growth, so it is fairly important that you're washing it on a regular basis, so it's good that you're keeping up with your hygiene routine. Do you find that you suffer from any blemishes or ingrown hairs, specifically under the neck area? Probably not as much because you don't shave here, so.
Yeah, not too much, just
Okay.
every so often, but it's very rare.
Okay. Just gonna do some very gentle combing through here, essentially testing for the same things we tested for on the scalp, just looking for any signs of excess fallout or abnormal breakage. Not noticing any signs of a fungal infection. Skin underneath the beard looks healthy. There's no signs of abnormal redness or inflammation. No tenderness here as I kind of tug on the hair slightly.
No.
Good. Okay. I'm just going to separate a small section. Just get a little bit of a better look at the skin underneath. Good. So none of that appears to be abnormal. And very minimal fallout, just 1 to 2 hairs there. Do you wash your beard with the same Head and Shoulders that you use on your scalp?
I do.
Okay. And you don't find that that irritates your skin at all?
No, it doesn't.
Okay, perfect. So why don't we move on to an examination of your eyes. Is it okay if we remove your glasses for this portion of the exam? So I'll set these on my table and we can put those back on as soon as we're done testing. So I have a Penlight here and I would like to just perform a couple ocular tests here, and I just want to have a look kind of in your eyes at your pupils, test your pupillary reaction, okay? So I'll have you look straight ahead for me.
Okay.
I'm going to shine this light at your face. Try not to look directly at the light.
Okay.
See what I just, a little hair there. Okay. Just taking a second to look at the sclera, looking at your pupillary health. Looking for any abnormal discoloration of the eyes, looking for any yellowing or redness, as well as your pupillary reaction. So now I'm going to perform a swinging light test. I'm just going to gently swing my light like a pendulum back and forth between your eyes, testing for pupillary reaction. So just keep looking straight ahead, just looking for that normal constriction and dilation. Any abnormal pressure as I do this? Feeling any pressure build up behind your eyes?
No, I don't.
Good. So I'm going to reach over your eyelids. Just kind of gently allow me to hold them open for you, and I'm going to do the same test with my light.
Okay.
Good. Okay. So now I'm going to have you follow my light with just your eyes. I want you to keep your head midline and just follow the light. Let me know if it causes you any discomfort. Very good. Good. And have you do the same thing without the light. So just follow my pen, move your eyes up and down. All the way to the side. Any pain or discomfort here?
No.
All the way to the side. Any pain or discomfort here?
No.
If I have you follow the light out and then follow it all the way in. Any blurry vision or double vision with any of that?
No.
Okay. And you're able to see the light in all 4 quadrants. So you can see this here, as well as here, and here, as well as here.
That's correct.
Perfect. Okay. So what I want to do now is have you keep your head midline, and I'm going to have you move your eyes in a certain direction as I shine the light in your eye, okay? So if I can have you move your eyes down. And up. Perfect. Can we go to the left and look all the way towards me? Some very brief vascular discoloration here. Do you smoke by chance, either cigarettes or recreational?
No, I don't.
Okay. Did you ever at one point?
No, never.
Okay. So you do have some slight discoloration in the vessels in your eyes. It could probably just be due to your kind of overworked reactions when you're looking at the screens.
Okay.
That's okay. So why don't we go ahead and try some kind of ocular tapping here. So I'm going to take my reflex hammer, just do some gentle tapping around your orbital sockets.
Okay.
So just relax, look ahead for me. It shouldn't cause you any discomfort. And hang your jaw open for me. Good. Okay. So no abnormalities in your ocular reaction. So I'm going to hold this up to your face. It's going to include one side.
Okay.
So we're going to test your peripheral vision.
Okay.
So I want you to tell me if you can see this here.
Yes, I can.
Tell me if you can see it here.
No, I cannot.
Tell me when it reappears.
It reappeared.
And does it disappear here?
Disappear.
Reappear here?
Reappear.
Disappear anywhere here?
Disappear.
Reappear.
Reappear.
Disappear anywhere here?
Disappear.
Reappear here?
Reappear.
Can you see it here?
Yes.
Disappear here?
Disappear.
Reappear
Reappear.
here?
Disappear. Reappear.
See that here?
Yes. Disappear.
Good.
Reappear. Disappear. Reappear.
Perfect. So let's do that on the other side. Same thing. Can you see this here?
Yes.
Here?
Disappear. Reappear. Disappear. 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 Reappear. Disappear. Reappear.
Good.
Disappear. Reappear. 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 Disappear. Reappear. Reappear. Disappear. 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 Reappear. Reappear. Reappear.
Good. Very good. So seemingly no issues with your peripheral vision. So the next thing I'm going to do is fully occlude. You should be able to see a brief amount of light here.
Yes.
Okay. And on the other side.
Yes.
Good. So what I'm going to do with this fully occluded is show you a series of numbers, and I want you to your best of your ability, guess what the numbers are, okay?
Okay. I can't see at the moment. 2, 3. Can't see. Can't see. 2, 4. Can't see. 2, 3, 5. 5. Can't see. Can't see. 5. 1. 2.
Good.
2, 3, 2, 1, 3, 3. Can't see.
a bit of better field of vision on the left side.
Yeah.
Okay, so let's do just a very brief test for visual acuity. So I have a Snellen chart here.
Okay.
And I'm just going to hold this out in front of you at about arm's length.
Okay.
Can you read the smallest line, whatever the smallest line is that you can see without your glasses?
CFDHJ.
Perfect. We cover one eye. Smallest line?
Same CFDHJ.
Perfect. In here?
Same CFDHJ.
Okay. And if we have you go ahead and put your glasses back on, I can do it for you. I just don't want to poke you in the eye. Is that okay?
Yes.
Okay. What is the smallest line you can read?
LTFPH.
Perfect.
LTFPH. And same LTFPH.
Can you tell me what these two colors are?
Red and green.
Good. So I'll have you look straight ahead for me. I'm just gonna measure your pupil here. And pretty symmetric there. Can you look up for me? Good. Okay, so no abnormalities with that. So the next thing I have is an Ishihara test book. So this is going to test for color deficiency. Have you ever been tested for color deficiency before? Usually they do this like in elementary school.
I don't think I have. Maybe just once.
At this point in your life, I guess if you were color deficient, you would know.
Yeah.
But we'll go ahead and test for it anyway.
Okay.
So can you tell me what this number is?
Yes, number 12.
Perfect. And do you see a number here?
Yes, number 8.
In here?
Number 5.
Perfect. In here?
29.
In here?
74. 7. 45.
Good.
Number 2. And no number there.
Perfect.
16. And no number there.
Do you see anything here?
Yeah, there's a snake-like pattern.
Perfect. These ones are a little harder.
35 and 96.
Good, very good. And do you see a number here?
Another snake-like pattern.
Perfect. And is it all the same color or does it change?
And it changes. The top is like pink and red. The bottom is purple.
Very good. Can I just have you read this last line for me?
Sure, Tokyo, Japan.
Perfect. Okay. So no suspicion of color blindness or color deficiency, okay?
Okay.
That's very good. I'm just going to put this away. So let's go ahead and move on into a brief oral examination. So I have a couple different things here. I'll start with just a visual inspection of your intraoral canal. So I'll have you open up for me. Good. Just having a look at the hard palate. Can you lift your tongue up to the roof of your mouth? Good. Having a look at the soft palate. Smile with both teeth. Good. Can you stick your tongue out and say ah? Perfect. No discoloration or abnormal lesions of the tongue. Teeth appear healthy. Not seeing any evidence of cavities or gingivitis. Okay, I'm just gonna lift up here and have a look at the gum line. Gums appear healthy and lips are not overly dry. Well moisturized. Elasticity is intact. Okay. Very good. Do you have any oversensitivity in your mouth?
Sometimes my gums are pretty sensitive.
Okay. How frequently do you brush your teeth?
Twice a day.
Good. Do you floss?
I do.
On a daily basis?
I'm supposed to, but every now and then I miss a day.
Okay. Do you use mouthwash?
I do.
And is it fluoride mouthwash or non-fluoride?
It's fluoride.
Okay. So I'm going to check your pharyngeal reflex, also known as your gag reflex.
Okay.
So I'll have you just kind of open up gently. 1, 2, 3. Good. Okay. Sorry about that. I know that's a little uncomfortable. And then actually while I have this out, I'm just going to have you bare your teeth for me. Any discomfort or sensitivity here?
No.
Just we kind of go along, none of that hurts.
No.
And along the gum line, is that sensitive at all?
No.
Just probably uncomfortable.
Mm-hmm.
Okay, and I'm just gonna kind of stretch out your cheek James, since we're testing your mouth, I am going to go ahead and do a bit of jaw strength testing your TMJ or temporal mandibular joint, okay?
Okay.
So this is a bite block, and it's just a hard styrofoam device that I'll have you bite down on. This will help me test for any signs of kind of bone density loss along your jawline, okay?
Sure.
So open up for me, bite down. Any pain or discomfort there? Okay. Other side, bite down. Any pain or discomfort there? Let's do the middle. Same thing, any pain or discomfort there?
No.
So I'm gonna do this like this, bite down. Good. Other side. Good. Okay, and no loosening of the teeth or anything with that, okay?
No.
Good. So what I want you to do now is stick your tongue far to the inside of your cheek. Good, and don't let me push it in. Perfect. Other side. Good. Can you puff your cheeks out? And can we do one side and the other? Good. Okay. Are you able to puff your lips out? Good. Okay. While I'm testing facial strength, if I can have you squint your eyes tight for me and don't let me open. Okay, and now open and don't let me close. Very good. Are you able to wrinkle your nose?
No.
You did. Good. Okay. Alrighty, and then if you can close your mouth tight and don't let me open, and then open and don't let me close. Good. Okay. So all of that was within normal limits.
Okay.
So let's go ahead and move on. There are a couple of reflexes in your jaw that I need to test. So again, I'll just have you hang your jaw open for me. Good. Good. Very good. Okay. Good. Turn your head for me. Just testing a reflex you have below your ear. Good. Okay. Any pain or discomfort with any of that, James?
No.
So I have a device here that I'm going to use to kind of pull up the skin below your ear. This is going to help me better visualize the lymph nodes that you have in this area. Just looking to see if they are palpable, if there are any signs of inflammation. They are palpable. They might be showing some signs of infection, but I don't see that currently. Can I have you tighten your jaw like this? Good. Good, and you can relax. And then if you'll just tilt your head back for me as far as you can without it being uncomfortable. I'm just going to move your shirt slightly. I'm just using this to visualize any visible lymph nodes, but I'm not seeing any. So keep your head like that for me. I'm going to palpate around your clavicle, just looking for any clavicular lymphs that might be palpable, but it seems like your glands are doing well at this time. Okay, so I'm going to just hold your head for you here. And I'm going to be palpating your throat and your thyroid. Let me know if there's any discomfort in this area, okay?
Okay.
Just looking for any signs of abnormal swelling. You should have some minor lateral movement here, which is normal. Good. Good. And you swallow for me. Very good. One more time. Perfect. Okay. Any pain or discomfort with that?
No.
Good. So I'm going to do some tapping along your upper extremities. You can adjust if you need to.
Okay, thank you.
Are you still comfortable?
A little bit.
Okay. We're almost done with our examination. You're doing very well.
Thank you.
So I'll have you just kind of relax your arms for me.
Okay.
I'm just going to do some palpating and tapping along your upper extremities. Our guest here is getting a little restless.
Yes, she is.
Good. Just testing for normal muscle tone. Any signs of atrophy or abnormality in your reflexes? Good. Good. The reason we're mainly testing on the one side is because you're not showing any signs of abnormalities today, and this is just a regular checkup. So generally we'll test on one side, do a few tests on the other just to double check. But if there are no abnormalities, you should be kind of symmetric on both sides. So I don't see a reason to test both sides today. Just having a look at the skin. Okay. Do you feel that this is cold?
I do.
Is there any change in temperature as we move that down your arm?
No, not
Just
cold.
cold all here.
Yes.
Cold all along the fingers.
Yep.
Inner elbow, maybe slightly colder.
Slightly, yeah.
Same on this side, it feels cold.
Yes.
And same here versus here, correct? No change in temperature on either side.
No change.
As well as along your legs, cold.
Yep. Cold.
Good. And along your neck here as well as cold.
Yes.
Okay. Head, cold.
Yes.
So I'm going to do just a very brief hearing test.
Okay.
You need to tell me if you can hear this sound.
Yes, I can.
Good. Hear this?
Yes.
Good. I want you to tell me if you hear it on the left or the right side, okay?
Okay. The right side. The right side. Left side. Left side. Right side. Right side. Right side. Left side. Left side. Right side.
Do you hear anything here?
No.
No?
No.
Do you feel any vibration there?
Barely, yes.
Okay. So I'm going to make a couple sounds with my hands.
Okay.
I want you to, again, just tell me what side you hear it on, okay?
Okay. Left side, right side, left side, right side, right side, right side, right side, left side, left side, left side, right side, right side, right side.
Good. You hear that?
Yes.
Tell me what direction it's moving from and going to.
From right to left, from left to right, from right to left, from left to right, right to left.
Good. Okay. Okay, and then lastly for your hearing test, I'm just going to be doing a slight puff of air on either side. I want you to say yes if and when you hear it, okay?
Okay. Yes. 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 Yes.
Good. Okay. So it doesn't appear to be any abnormalities with your hearing. You have a little bit of a sharp kind of wheel here. I want you to close your eyes and tell me when I start touching you and when I stop, okay? So you're
Okay.
going to say start when you feel it and stop when you no longer feel it.
Okay. Start. Stop. Start. Stop. Start. Stop. Start. Stop. Start. Stop. Start. Stop.
Good. And that's just a little bit of washable chalk, so I'll just wipe that off for you.
Okay.
Can you tell me if there's any difference in sensation as I move around your arm?
No, there's not.
It all feels the same.
Yes.
And all the same sensation here, here, and here.
That's
No
correct.
difference in sensation as we move along.
That's correct.
Perfect. Okay. I'm going to do a little bit of sharp or dull testing. It's just going to be very brief.
Okay.
Can you feel that this is dull versus this being sharper?
Yes.
Okay. So I want you to tell me if you feel sharp or dull.
Okay. Dull.
Okay, so no abnormalities there. I want to do a very brief test of your sense of smell.
Okay.
I have 3 vials here, and the smells are very similar. This is a little bit of a difficult test.
Okay.
So I want you to tell me if you can smell the difference between the 3. So we'll start with the first one. Keep your eyes closed for me. Take in kind of a gentle wafting of this.
Okay.
What does that smell like?
Lemon.
And do another one. What does that smell like?
Tea.
Okay. And then I have one more. And what does that smell like?
Orange.
Good. Okay. Very good. So all 3 of those were correct.
Okay.
Just to be sure there's no abnormalities with your sense of touch, you are able to feel this and you feel that it is sharp.
Correct.
And you feel here that that is sharp.
Yes.
And on your scalp as well, probably a little more dull, but you still feel that it's sharp.
I feel it.
Okay. And you feel that here as
Yeah.
well, sharp. And there's no point where it feels less sharp than anywhere else.
No, it's not. That's that.
All right, James, well, that is going to conclude our basic physical examination today. We didn't find any abnormalities.
Okay.
Everything, as far as I'm concerned, was within normal limits.
Okay.
We did just kind of a very basic ENT, tested a few of your cranial nerves, and they were all seemingly normal. No abnormalities with your sensory exam, and your hearing is intact and within normal limits.
Okay.
Visual acuity was all normal. With your glasses, you are able to see 20/20. Okay, so because you are a new patient, I would like to see you back in 6 months.
Okay.
The first year with you as our patient, I do like to see you twice, and then after that, it's annual unless there's something more acute going on and we need to see you more frequently, okay?
Right. Okay.
Is there any questions that you have for me today?
I don't think so.
Okay, so I do have you set up to receive notifications from our patient portal.
Great.
Serena will help you a little more when you go up to the front desk.
Okay.
Just let her know that you were set up as a new patient today. She'll help you download the app on your phone and you can kind of go from there, okay?
All right. Awesome.
If you don't want to use the app, you can also use the URL link that was
Gotcha.
sent to your email.
Okay. Cool.
All right, well, thank you so much, James. It was very nice to meet you, and I hope
Thank
you
you.
have a good day.
All right. You too.